hi everybody, welcome. Is everybody in, Melina? Yeah, okay, perfect, welcome, happy to see you. Well, I can't really see you yet, but I will. So just wanted to let you know this will be recorded. We're gonna try today to get even a little more interaction once Lisa goes through the PowerPoint, so that we'll have you just ask questions instead of having to put it in the chat, etc. And happy back to school. Can't believe it's already September. So Lisa, will pass it to you, and I'm happy to interject wherever you want me to.
Thanks. We can jump ahead to the next slide. So Monday, happy Monday, everyone. I'm looking at the slide to see which slide it was. Things did change over the weekend. The good news is that we continue to remain in the moderate zone according to the Centers for Disease Control, but that still is old purple. So we're going to be creating a crosswalk so the community can start understanding the difference between the new CDC's COVID risk scale and our old blueprint scale. So I think that's important. The reason I paused in the beginning, because I forgot we just did this on Friday. And if you were to look at the slide from today, you would see a slight uptick in the number of cases. So in the week prior to Labor Day, we were seeing consistent decrease in cases on a daily basis. So going from 40 cases a day down to 30 cases a day, down to 20 cases a day. We even had a couple of days in the teens, which is what drove that kind of sharp decrease. We absolutely knew that going into the Labor Day weekend, people gather indoors, drinking unmasked and all those travel activities. And so just as expected, we've seen an uptick in cases that started on Thursday of last week. So since Thursday of last week, we bumped up to around 40 cases a day diagnosed in Marin County. Again, that still has us in the moderate or yellow level of the COVID of the CDC tracker. And with that being said, the biggest concern to me is in the uptick is it's predominantly, again, remains among the unvaccinated persons in our community. So you can jump to the next slide because I think I have yes. So this is our unvaccinated case rates, which if you look on our website today, you would see that orange line. You'll see the blue line continue to hold steady and actually go down. And then the orange line ticked up a little bit on today's website. And that's driven, again, people who are not vaccinated against COVID-19 are 5 times more likely to be infected with COVID-19. So COVID-19 activity absolutely is driven by unvaccinated populations, even though now our concern is just the risk of breakthrough cases, which we consistently see. Sometimes it approaches 50% of the new cases are among vaccinated persons. But if you can imagine, our population is divided where the majority of our population is vaccinated. We probably will hit a true 90% this week of 90% of all eligible residents will be fully vaccinated in Marin County. That will be probably one of the first counties in the nation to have that highest level of vaccination rates among its eligible population. And we continue to have vaccination efforts in the community and our lower HPI communities. This weekend, we vaccinated 197 people in the Canal area. So again, that's just for you. When you look at data around race and ethnicity, you'll see very, very high percentages in our Latinx community. Just to always take that with a grain of salt, because there's underreporting of the population in our census for individuals who are Latinx because of concerns around documentation status and other legal issues. Even if they are documented, sometimes there's underreporting. So we might have over 100% of the Latinx population of Marin vaccinated at one point. Be prepared for that. And especially we anticipate when they start adjusting with the new census that will even have we'll have a lower percentage of our population as being reported as Latinx, even though we have a higher number of people in that community. So this continues to tell this tale that this is a pandemic, a tale of two cities, that the pandemic is really driven by the unvaccinated and not the vaccinated person. So our vaccinated case rate would probably be in the orange tier. So that's what our challenge is that we just have these very high case rates among unvaccinated persons. You can jump ahead. This is one of our concerns. People are, one of the reasons we issue orders and mandates is not just to, it is for the health and well-being of individuals, but it's also to protect our healthcare system. Our healthcare system remains very vulnerable in Marin County. Even though it looks like few hospitalizations, it bumped up, and we would expect just as cases are bumping up with post-Labor Day, we're going to expect 2 weeks from now, we'll probably have another second peak of hospitalizations in the county. There's always a lag between new cases and hospitalizations. And again, consistently 90% of our hospitalizations are among unvaccinated individuals. So that's always a concern for us. So one of our roles is protecting the individual, and our second role in public health is protecting our healthcare system. And so having mandates like vaccine verifications for first responders and regular testing for unvaccinated individuals, and also indoor mask mandates, those are all tools that we have, or that are both pharmaceutical and non-pharmaceutical interventions to protect those hospitals. And again, you've probably heard it in your networks, they're really short-staffed in our hospitals. There's burnout, I know, across all sectors of our community, from schools to healthcare, but our healthcare systems across the Bay Area, state and nation really are struggling to keep staffing levels. And it's the number of your percent availability. When we report percent availability, it's not driven by the actual number of rooms or beds in a hospital, it's the number of staff available to staff those beds and rooms. So jump ahead. And this is just again to show you, I know a lot of the stories that you're hearing from the community, from the media at large, is that there's more poor outcomes now being seen in the pediatric population. That absolutely is not being seen in Marin County. We have a highly vaccinated youth population of those eligible, and we consistently see that the social drivers of health and the benefits we have from where we live, our zip codes, are protective to our community, and we're not seeing significant hospitalizations or at all. And we've had no deaths of anyone, I think, under the age of 35. We've had no deaths under the age of 35 in this nation, where you're hearing about hospitalizations. And there's a new article that was published. It's in hospitalizations are prominently among young Black boys who have higher disparities in health, higher levels of diabetes, asthma, and obesity. So that's what our research that's now available from across the nation is really showing, is again, racial inequities in this pandemic. So you can jump ahead. So it continues to be Delta. We are continuing to sequence. We are really proud that we were we were the canary in the coal mine to identify Delta because of our commitment to sequencing, and we continue to sequence. What this is just showing you is that Delta remains dominant, but we're seeing new mutations of that Delta. That's what viruses do. Every generation when they jump from one person to the next person, to the next person, it's always mutating, trying to learn how it can evade your immune system. So that's how Delta arrived. It's learning how to evade immune systems. And unfortunately, the trick it figured out is the exact target of the vaccines that all of us have received. You can jump ahead. This was probably on it was last Monday. It's always interesting what you wake up to the news every week. And so the Mu variant was on the news last Monday, triggering a lot of concern and conversation in the community. We know how viruses mutate. They either become more transmissible like Delta, they become more deadly, which is concerning when it's a more severe disease. We have not confirmed that with Delta. We've had higher rates of hospitalization, but there really hasn't been a research study to show that people that are infected with Delta, that it's a more lethal virus. And then the other ways that I described that viruses trick us is that they figure out how we're immune and mutate itself so it evades our immune system. So the Columbia variant probably has been circulating on the globe probably since as early as the fall of 2020. It was identified in Colombia. If you visited Colombia, you know it does not have the same public health infrastructure. So I suspect it has been circulating much earlier than when it was first identified, which is why you can see that it's already mutated to 39, or spread to 39 countries. Why it's concerning to us is there's so many mutations, and 6 of those mutations are exactly where again, our vaccines are targeted. So we're going to be following this one closely, but I would not be surprised if a week or two from now you hear about another variant. We've just never in our history in humankind have been able to track virus mutations like this, where it's been now part of, Delta. Imagine 20 years ago talking about SARS, you would not have known the different virus mutations or names of mutations. So we're just in a much informed space than we've ever been due to testing and technology. So jump ahead. All right, so more about vaccines. So the other talk, if it wasn't about the Mu variant, it's been about boosters. we are anticipating, so the FDA is meeting on September 17th, that's this Friday. They will may or may not be approving or authorizing the use of the booster shot. And Pfizer is the only vaccine company that submitted its vaccine for approval for a booster shot. So then it really is going to depend on whether what is going to be recommended by, so FDA doesn't make recommendations, it just authorizes. Once and if the FDA authorizes the use of this vaccine as a booster, if the CDC does not provide guidance immediately, and I do not suspect they will because they are planning on meeting October 20th, the state of California through the California Department of Public Health and the Western States Scientific Safety Work Group may opt to evaluate the research that is released by Pfizer and the FDA and make its own recommendations. So that being said, our county is preparing for possible booster clinics as early as September 25th. This is not a public health emergency. We see these, the role of the county is really providing enhanced booster clinic support, and see the role of getting your booster, just like you would get your flu shot or any other vaccination, should be in pharmacies and your healthcare providers. That being said, we are preparing that the CDC or Western state governors will make a recommendation for boosting the over 65 population. We often talk about students and schools, which has a younger population, but Marin has many more individuals over the age of 65. So we would be serving in public health just to debulk. The way it's being described, but also what you're seeing in the news is it's like giving someone with a life jacket another life jacket. We are seeing waning immunity with, especially with Pfizer. That being said, it is proving consistently to be protective against severe disease and hospitalization. On the other hand, if you also saw NPR this week, there's a journalist who described her firsthand experience of having a breakthrough case of COVID-19. So saying it's a mild to moderate case of COVID-19 is in no way to diminish that someone that has a breakthrough case of COVID-19 could feel like they have a bad flu for a couple of days. But what's different is that they're not going to be hospitalized. So we're really seeing the vaccines prove effective at preventing hospitalizations. Jump ahead. So sorry, I think I spoke to some of this. So again, we're expecting all healthcare providers should be the ones providing this booster shot to their eligible patients. So public health, in the past, you've seen us set goals of how much of the population we want to vaccinate. We're not setting the same goal because again, it's not a public health emergency. Our goal is 1 month after the CDC recommendation is issued, that wait times for an appointment for a booster shot would be less than 2 weeks for that older adult population. And I described the populations we're prioritizing. We're also looking again at just supporting access to booster shots through private and public partnerships with Safeway, Walgreens, Rite Aid, and other partners. Jump ahead. Pediatric vaccines. We do think this is coming down the pike. It feels like it's on target for an October 30th launch. So we are also expecting pediatric and family doctors to provide this vaccine in their clinics. We're working with all of our healthcare providers to build their capacity to provide the vaccines in their clinic, because we know many parents in the 5 to 11 population would want to talk to their provider about the risks and benefits of vaccination. But we are anticipating it's going to be approved. We're partnering with the Office of Education and Safeway, and we're already starting to see the calendar build out, where we'll be offering both school-based clinics during the week and then weekend clinics from October through December to vaccinate all of the kids who are newly eligible. This is an ambitious goal to get to 75% of newly eligible children. We do think because parents in their networks have really seen, unlike adults who get infected with COVID-19, children who get infected with COVID-19 typically are asymptomatic. They may have a headache for a day or just some GI illness for a day or two, maybe a sore throat, and then they're back to normal within 3 days and ready to go. So we know that a lot of parents are discussing that. That being said, our pediatricians in the county will be preparing a statement recommending that all eligible children in Marin County get vaccinated, because this is part of the tools that will get us to endemic circulation, where we're at low, we're having sporadic cases of COVID-19 in our community rather than the volume of cases that we're seeing every day. So you can jump ahead. Oh, look at them. So they're busy bees at work. So just like I said, these are the large scale clinics. We are preparing for first dose and second doses. And so you can see this schedule. So our team is, again, fully committed to, unlike boosters, where we see is not a primary role of public health. We do see vaccinating this pediatric population as a primary role of public health. And to that end, we are deep in planning on this. So more to follow with actual sites. And I just wanted to share this with y'all. This is really interesting. We saw a similar presentation from San Francisco and thought this was really compelling, just to show the percent of the cases that we are investigating every week based on age. And you'll see that throughout the pandemic, infections in children have been the minority of cases. The exception to that is that May activity that you see. So it's really important to, when you're looking at this, because it looks like such a dramatic surge, it's such a dramatic change in that May time because we had such small numbers. So as I described to you earlier, as we're getting 40 cases a day of new COVID-19 activity, that month of the early month of May, we were only getting 2 cases a day of new COVID-19 cases. So big difference between 2 cases a day and 40 cases a day. So when we had one large outbreak at a school where we had 12 students test positive, that was that shot that number up really high of what percent of new cases are among children. And this also just shows you why we were much more conservative in our recommendations to start the school year. It was a new variant. We saw much more contagious than we had seen before. We saw this change in cases, and again, which hearkened that we're going to be seeing this 4th wave. So this activity hearkened the 4th wave that we're currently experiencing with the Delta variant. And so this is why we recommended entering the school year at mitigation level C, where we have both indoor masks required, both by the state and the county, and outdoor masks strongly recommended by Marin County Public Health. And I just want to reinforce that the outdoor masks, with all the cases that we've been investigating, and to be clear, the overwhelming majority of cases that we investigate and possible exposure events that we investigate are all from community-based transmission, not from school-based transmission. We're identifying cases who were exposed at home, at play, then get diagnosed, and then we work backwards to identify anyone who may have had a close contact 2 days beforehand. So this also just shows, again, the protections. Once adolescents, you see that kind of adolescent case rates start going down significantly. We have to update this chart for you, but once that adolescent population gets back into school, it's a much more supervised structure environment. So they're less, as a vaccinated population who are now in a more supervised structure environment, their likelihood of COVID-19 exposure decreases significantly. You can jump ahead. And I know that there were headlines made when they reported 71 cases. So I just wanted to provide an apples to apples comparison. What the world looked like when we hit nearly 500,000 student days last year and had 61 cases we investigated, to the world today when we had hit nearly 500,000 student days and we investigated 71 cases. So if you can remember back to December, we were in a very different state. We were under a framework of the blueprint. We were in purple, so a lot of our activities were restricted. Parents were advised that their students shouldn't participate in, I think at that point, any more than 2 activities. So after basically 3 active school, aftercare, and 1 extracurricular activity. It took us to December to get to 500,000 days. So we had 17,000 students who were in person in school by that time. Most of them were on a hybrid schedule, attending school only 2 days a week. Also, we didn't have access to testing like we did this year. So last year, if you remember, a lot of people were disheartened by testing. There are times in July and August where it took 2 weeks to turn around test results. So people weren't utilizing testing as they should. Flash forward to today, we have universal masking in place and no physical distancing. If you remember back to last year, desks were 6 feet apart. So there's no physical distancing now, just the masking. We now have 38,000 students in school 5 days a week, full time. And at this point, this is going to be updated. But at the point of when I made this slide, we had 4 suspected school transmissions. Only 2 we're calling confirmed transmissions, and 2 are undetermined. So we never even had an undetermined category, and we're recognizing the need for that, because when we do larger scale testing on a school site, even in a classroom, we may identify a case that wasn't picked up, and then we're not able to identify any close contact to the individual, the index case we call them, or the infected individual. And so we call it in medicine an incidentaloma, where you find something, it's just a coincidence of finding them by testing. So we're considering adding another category of undetermined, where our investigation doesn't identify exactly where that student or staff person may have been infected, but they did not have it was confirmed they did not have close contact with the infected case. And just to describe, sometimes when we come in and test, we only are testing those individuals identified as close contacts. Sometimes when we come in and test at the school site, we might test the whole classroom out of an abundance, depending on the information we receive as part of the investigation. We might test the whole site out of an abundance of caution. Or if we have resources, sometimes we may, and depending on the nature of the school, we may offer just a school-based testing where we're testing a lot of people, regardless of their potential exposure. The risk of doing that larger school-based testing is, and we already experienced it last week when we tested at Bayside, is we can get false positives. So we do reflex positive tests in asymptomatic individuals to PCR tests. This is the confirmatory test to make sure there's that genetic evidence of an infection. And this is just what happens when you do population level testing and you have a low, we call a low pretest probability, is you can get false positives. So that's one of the risks on why we still are doing the reflex PCR in kids who test positive, because we excluded one student. We got the results back from their PCR and they were able to return to school and be back in school. So a lot more, and this is just, again, another thing to share. We didn't offer this level of testing on schools at all this last year. So we're learning, we're building our capacity to offer more testing. There's much more work to do. Most of my days last week and this week is working on building up an infrastructure to have a very robust and rapid response testing, and we're working on that. And there'll be more slides to describe that. Jump. There we go. More slides to describe that. So there's there's different testing strategies. This first testing strategy is a pilot of home-based antigen test kits. So there are 2 tests in one kit. Everyone's eligible. The problem is right now we have a very limited supply nationwide of these test kits. Our vision is that every student in Marin should have access to at least one home test kit. We know the cost is prohibitive for some families, so we're going to be prioritizing distribution of our test kits to low-income families who are receiving free and reduced lunch. But the vision is that any student, let's say they develop symptoms, they become symptomatic at home, they can test at home, and then they can return to school with a negative test as long as their symptoms are improving and they're fever-free for 24 hours. And then also for students who have a known exposure, they would have a test at home to be able to test themselves 5 days after that exposure. So this adds just, again, another layer of protection. We are also partnering with Marin Health to onboard more staff to support testing in the schools. So we have a larger testing team. We're working with the state. The state has allocated some testing resources to the county. So we're working with the state to confirm how many testing resources literally means how many people are going to be paid for by the state to support testing in our community. And so each county, based on its population and racial inequities, are allocated a certain budget and certain number of people. So we're just waiting to confirm what is the budget for the total of Marin County so we can efficiently deploy those resources. And then all that aside, schools can independently enroll in the state school rapid testing program. There's if they independently enroll, they have to get their own CLIA waiver as a school. That's a laboratory waiver. They have to go through a whole level of training. We are recommending this for all schools. It just takes time. We ourselves in public health, and at this point, I think we're pretty expert in testing and resulting. We ourselves are finding it challenging to utilize the primary data management system. So it's slowing us down a little bit, but we've set a goal for ourselves that we're going to become full utilizers of this, the state testing platform, despite its burdensome nature. So again, any school in Marin County could enroll right now in the state program and implement its own testing program without the support of public health locally, but with the support of the state. We're just seeing that the experience only locally is most people, including ourselves, need more time and assistance to get effectively onboarded into the state program. Jump ahead. So our goal is I keep saying it, I want every kid to have the opportunity for perfect attendance this year. We want to keep all of our schools and classrooms open, and we're focusing on reducing that educational attainment gap that's been widened across this past year and a half. Just deeply grateful for everyone from the Office of Education who sits on these calls and builds these slide decks and keeps us together. I think our reason for success in Marin County is that radical collaboration that we talk about, readiness to change and to adapt. We'll be presenting this week to the California Department of Public Health on their state meeting, our dashboard. You won't find a dashboard like ours across the nation, having the level of transparency that we have. And we're really proud of that. We'll also be just providing an update on our outbreak. So, and again, just showing our commitment to engaging both in research on the science side and then in collaboration and continue our partnership with the state. And then new this year, and I just want to, the game changer is we're starting this year very different than last year, is that every person in that school, except anyone under the age of 12, should be vaccinated. Everyone should be vaccinated. It's what's going to protect people. I think a lot of people hear us talk about vaccinations and think about how we're protecting the kids. Sometimes our biggest concern is protecting staff who are adults who are unvaccinated from infection. Breakthrough cases will happen, and that's just going to be part of as we navigate the endemic circulation of this virus. But our worst case scenario is a staff person who is unvaccinated, getting infected and having a poor outcome, either hospitalization or death. And we've seen that now. I don't know if you saw the report in Sonoma, a law enforcement officer, a young guy passed away. Vaccination is to prevent hospitalization and death of us older adults. The role that children and adolescents play in getting vaccinated is it helps us achieve that endemic circulation and achieve low levels of community transmission, which is going to allow us to return to our new normal. We've updated our 32-point guidance, which you've all seen, and I've talked about the testing. And again, we just keep on trying to expand our team to make a bigger boat to support this work and support the schools. Jump ahead. And this is just a link to all the resources that are available. We just released on Friday an updated guidance document for music, sports, and extracurricular activities. So you can find that on our website. So you don't need to go through this. You can jump ahead. This might be the last slide. Maybe. Yep. So we can go to questions.
Great.
Or Mary Jane can add comments before we jump to questions.
No, Lisa, nothing to add. Great job. Thank you very much. Okay, so anybody have any questions for us?
Looks like Linda might have a question.
Great. Hi, Linda.
Hi, how are you? Can you hear me okay?
Yes, perfect.
All right, so at the meeting in August, Lisa, you said that we shouldn't still be singing in schools. And I know that in our district, all the music classes, band, orchestra, band and regular music classes and chorus are all now being held indoors, and students are singing indoors. If that's the case, how do we get that message to all the teachers and all the schools and all the districts that students shouldn't be singing indoors?
So our updated guidance shapes that a little bit and says when practicable, those activities should be held outdoors, but it is allowed to be held indoors. We are strongly recommending that anyone who participates in those activities, if they're over the age of 12, should be vaccinated in order to participate in those activities because they are higher risk activities. This is where we've implemented our first enhanced recommendation around testing for asymptomatic unvaccinated individuals. So we are now recommending that any asymptomatic unvaccinated individual who participates in these high-risk activities, from singing, band, performing arts to some indoor sports, and they're identified in our guidance, and maybe Melina could plug the link into the chat because she's faster than me, especially when I'm thinking, that they should, not must, but they should have a testing program for those weekly testing for unvaccinated, asymptomatic students, staff, coaches who are participating in these higher risk activities. So that's the new recommendation. And it should be weekly testing, weekly PCR, or twice a week Binax testing. And we're really hoping that that recommendation, especially for the 12 and over population, really shifts. I mean, schools can make the decision. If you're going to be in van and you're going to be indoors, you need to be vaccinated. The schools have the right to do that. And that's what we're recommending. We are not mandating that at this time. So we're hopeful that this new testing requirement and the more and stronger specific language around these high-risk activities shifts more people to adherence to our recommendations, and shifts, more importantly, shifts more people who are eligible toward vaccination.
And so how are the schools, again, how are the schools and the teachers going to get that information?
It's been distributed to all of the schools. So I would expect Novato, all the districts to review the new guidance. It just came out, give them some time. It just came out on Friday. They had a little briefing in advance. So the guidance just came out on Friday, and I'm sure knowing some of the exposure events that we're investigating, some of the schools have been pretty busy. So it just came out on Friday. I give them a week, but I would expect, in a week or so for them to provide how they are responding to our updated guidance.
All right, thank you.
Sure, Morgan.
Hi, I was just wondering when you think or under what conditions we might be able to lift the outdoor masking recommendation.
I am cautiously optimistic we're moving towards that and it depends on this last little blip by the end of September, early October. I think we're going to see a repeat of what history repeats itself. I don't know how many history teachers are on this call, but history does repeat itself. If you overlap a year-on-year comparison of the waves, they're probably very similar. And it's really driven by human behavior. So I'm 100% anticipating, I hope I'm wrong. I'm 100% anticipating a fifth wave that will start in that week right before Halloween. So right before Halloween, students are going to move and families are going to start moving indoors, having Halloween parties. They're not going to be the same restrictions that we had last time. They're not going to heed recommendations around travel. And if you saw my slide, it's too early for us to even have fully vaccinated 5 to 11 years old. So I don't think that fifth wave is going to be a big hump. I think it's going to be a much smaller hump is what I'm hoping, but I think it's going to be there. So I think we have this window, and I think this is going to be the challenge for us. I think we have this window, and we made it clear with our mitigation strategies, it can go up or it can go down. I think we may have a window between end of September into late October to have to say outdoor masking is not required, but maybe recommended. We have a lot of benefits from the outdoor masking because when we do contact investigations, it helps our investigation by just kind of saying, oh, everyone who is outside was masked, so we don't have to go on this hunt, and we really can talk to the case and the families themselves to identify who are their true close contacts, who are the friends they're walking home from school and participating in those activities, because those are the individuals. When we look at it, it's really those individuals that are testing positive for COVID-19. So I wouldn't be surprised if some schools, even though we remove the mandate, and we just had this conversation ourselves at the county level, is once the mandate is removed, I believe the county and its buildings will still be potentially requiring people wear their masks when they're indoors at least. Sorry, I jumped to the indoor mandate. So I think you'll see when a recommendation is saying it's not required, not recommended. I'm trying to get through the recommended required. We strongly recommend outdoor masking. When we're no longer strongly recommending it, there may be schools that still are requiring it, and I think that's okay. It's based on the culture of the school. We're not seeing, that being said, we are not seeing outdoor transmission. We're not seeing outdoor transmission when kids are eating at the same lunch table. We're not seeing outdoor transmission when they're hanging out on the playground, all huddled up in a structure. It's primarily indoor transmission and transmission among close contacts who are part of a social network outside of the school environment. Again, we've had occasional true close contact indoor transmissions in the school.
I see Steph has her hand up. I wanted to follow up on that if I could really quick with just a comment, and then I want to respect Steph's question. Just that I think there's for me the big theme here is not necessarily whether or not the policies are enough to keep us safe if they're followed. It's the enforceability and whether or not they're being followed. So I look at the outdoor mask mandate from the lens of enforceability, and it makes the indoor mask mandate a lot easier to enforce if students can just step outside and take their mask off.
Mhm.
It makes lunchtime masking a lot easier to enforce. Hey, just go outside. So it really, and it's more consistent because kids, they walk to school with their friends with no mask, they cross the border, they put their mask on. Well, they're still, so there's a consistency there. So I'm not suggesting that you change your policies now. I would just suggest that you really look at it with the lens of what aids in enforcement of the things that really are important to keep us safe.
No, I think that's a really good point. And I think our other consideration, you and I have spoken about it, is being differential between secondary schools and primary schools that's not like necessarily baked in how you see the mitigation strategies, but I could absolutely see that we strongly recommend masking outdoors for the elementary schools, and we'll have like B.5, so somewhere between B and C, where there is no outdoor masking, and just from, again, us learning that, yes, secondary school students, it's better to have them have that time off. It's really more realistic. And I think a decision time would be is upon us, and especially once we start seeing the vaccination rates in those schools, which could be also reinforcing just the consistency of that indoor masking. So I think thank you. I think that's a really good feedback and recommendation. Steph?
Okay, I don't know if this is a question for Mary Jane or Dr. Santora, so forgive me, but in looking at the decision trees, there are two separate decision trees for vaccinated and for unvaccinated. People that are sort of on the front lines, are we allowed to point blank ask so we know what decision to make? Or how do we go through that decision tree appropriately without sort of infringing on people's rights to privacy? Like, how does that sort of work safely?
There is no HIPAA privacy, and I know this has probably been ongoing since vaccination started. There's a very strong sense of privacy. One, schools aren't covered entities, so they're not covered under HIPAA to begin with. They're under FERPA. Is that the one you guys are under? You're under FERPA. And this is something that's been clear by the state, made it clear when they implemented vaccine verification policies, that even Bottle Rock organizers can look at your vaccine record. And so absolutely, the first question we always ask is, what is the vaccination status? And the second question is, were they masked? So those are our first two questions. So if you're on the front line, absolutely, the question should be, are you vaccinated or not, especially if you're helping us in an investigation. And then we are trying to try and update our decision tree to have it both on one, to try and make it more user friendly. So that's going to be the next iteration of the decision tree. Still has to pass the nurses. They're tough cookies to pass. So but we already, you can see an example of it with our, we issued a new decision tree. I don't know if Melina can find it and put in the chat for non-TK through 12 environments, but for childcare environments that, again, is more user friendly, and not to have those old boxes where people can get lost a little bit. But absolutely, you have a right. If you're a friend, I think the caveat to that is you have to need to know. And I think that's the challenge we probably have seen the most, is the anxiety levels that go up on a school campus when there's a known positive. It depends on the people, but you can have multiple staff who never could have even possibly had contact with the infected person, just want to know who is infected. We're working with the public health liaisons and the principals to talk to the people who we know do need to know, and to provide notice to those who do need to know. We've recommended kind of more broad notification to stop it in its track, because what breaks trust in the community with us, and that's the last thing we want to do, is when they feel like we're holding back information from them and we're learning about positives. The counter to that is, a lot of people hear about positives in the community and they associate it with the school, and it really shouldn't be associated with the school. It's really the outside activities, where we had the kids were on a football team, their siblings went on a trip, those siblings were on a soccer team, and then they hung out with those kids. They might have attended the same middle school, and they might have attended this high school, and there's this connection, and I think people are just still anxious. So that's the other thing our team is working on, is just strengthening the communication trees, and to be more supportive to schools as they're providing notifications to different groups based on their potential risk of exposure. Mary Jane, anything you want to add? I'm yapping a lot.
No, I think that's great. I mean, that, as we've said, the very first question public health asks, are you vaccinated? Who's not vaccinated in the group? Because that helps them determine what's next. It's interesting, I'll just add recent email from a parent not wanting to disclose their child's vaccination status. And just a reminder, the data that we have on the dashboard is the countywide data, right? And the schools are providing information that's school specific. And I was trying to explain to the mother, well, actually it is important, because if the school already knows who's vaccinated, they'll be able to move more swiftly as they determine what the next steps are. So you're actually aiding the overall system in being more efficient by providing the information. By the way, it didn't change your mind at all.
That's our biggest, I think people don't understand like what happens when we find out there's a positive case. So it's having all that information. Like, so the best example was at a high school in Nevada, where it's like worst case scenario. It's like the first day of school. We don't know where this, they didn't, and again, it's no fault of staff or teachers. It just was like the first 2 days of school. People are just trying to get organized. But by not having the vaccine, the school had to like hustle to try and get the vaccination status to find out who needed to be quarantined or not be quarantined. They had to try and they had incomplete seating charts. And again, that's was another challenge. And the more information that we can have all ready to go, the easier it's going to be. And it would also help us, like, let's say if we do go to that next step and come on site for testing, all that information together and organized is super helpful. The challenge is, and I've been on site to a lot of schools. I know how lean your schools are staffed. I mean, this is not, more is being asked, and schools don't have the equivalent amount of resources to do the work. So that's why we just remain so committed and thankful for the public health liaisons and the principals and all of you for what you're doing. Because it's not like you've got a whole new COVID budget to supplement your instructional budget. So, and that's why we're just committed on our side just to pull down as many resources as we can so we can try and make it better.
Lisa, I have a question. Do you anticipate, so with President Biden identifying, right, the need for vaccinations, and now what we're seeing is that affects all the Head Start programs, right, in our county and beyond. And there's some research being done, given that our special education programs get federal funding, whether that will be somehow aligned in this. Do you see the time when, I don't know, that we're going to see a mandated vaccination, number one? Like,
I think we're waiting to see what happens with the recall, honestly. I think our governor has aspired to lead the nation in vaccination, and vaccine mandates are part of that. Because of the election, we've seen some hedging and compromises to probably get that postcard that you received in the mail that you might have received this week. And so I think it really will be dependent on the results of the election either way. Where either way, whether the recall is successful or not, there might be just a double down stance on vaccine mandates for staff. And I think this is, and I hear this too, it's been, I read and respond to every email that I get from the community. And I got one this weekend. It was sad. There was a preschool teacher that was affected by a decision. I've strongly recommended, requiring vaccinations. We're not mandating at a public health level. And a local school did mandate that. And then a teacher is not willing to get vaccinated. So may not continue working. I don't know the outcome of it. And there are angry parents to that. But in the same day, we were managing a closure of a preschool because of exposure of a staff to an entire classroom. And as you've seen, we've had these unvaccinated exposures of staff to classrooms, and the likelihood of that level of exposure, especially in the younger levels than the second grade and younger levels, is high. Just because you need more hands-on, close teaching, especially in the Head Start TK space. And we already know of hundreds of families that have been impacted by one or by a couple of unvaccinated staff. where they're they have no date, they have no take care, et cetera. So it's a hard space that we navigate, and we really do strive to be thoughtful in our recommendations and when we use the mandate, and when it's best to have a recommendation, and it's a complex space.
Mhm. Morgan?
Thank you. So just first quick clarification, we actually kind of do have extra COVID resources because we got all this extra one-time money from the state and the federal government. The tricky thing is, we can post a campus supervisor position or a custodial position, and we're having the same issue everybody else is having where, nobody qualified applies. So it's not necessarily a resources issue as much as just like, we're not that nimble. We can't hire that.
Yeah.
I want to just make sure I'm super clear on a point you said earlier. So we're on firm legal footing as a school if we say vaccine mandate to be in music class, vaccine mandate to play sports. That's firm legal footing as a high school.
I would have them review their counsel, but
Naturally.
I review a counsel, but my understanding is you can require vaccines. Like you see in LAUSD, I mean, that's the new big example. They're going to require vaccines. That's the other thing I hear from the community too. We're just also a very different community. We have very high vaccination rates among that group. And again, it's when do you wield the mandate or orders and when do you use recommendations? I fully understand when I looked at the data, you think of the size of LA County, how unvaccinated their classrooms are, and except in like a Manhattan Beach, which has equivalent vaccination rates to us. If you know that area, it's a very affluent community. I understand absolutely why they did that. I also understand why we're not moving in that direction. And I understand why other school districts within Marin County might, just like I saw the board of a preschool might move forward more quickly in mandating.
Okay. I just want to make sure that I heard you correctly and interpreted correctly. If the district chose to pass a mandate for either a specific activity or frankly for the entire district, that is supported by public health, not mandates, but certainly within recommendations, and appears to be a legally sound thing to do. Okay, thank you.
I don't got that JD yet, but
Fair. The legal question I'll save for somebody else.
but that's consistent with what our county council has advised us, is that we don't need to do that.
Anybody else? Okay, well, first of all, thanks everybody. Just a reminder, tomorrow at 1 o'clock will be this meeting, right? Similar PowerPoint, that's the one for the whole community. So that's tomorrow, and then tomorrow night we'll be doing a similar session that will be, I think, 6 to 7, Lisa, that's focused on parents. So we're trying to continue to provide multiple opportunities for members of our community. So thanks, everybody. Lisa?
The only thing I just want to tell, so a lot of the presentation will be the same, but there'll be an update in the dashboard. So we're getting back on, our dashboard is getting tuned up just to have that consistent. We got to that pace last year that you knew every Friday, every 11 a.m. as we submitted the data. So there'll be 41 more cases investigated. I think that's the number that's added. It might already be on the dashboard. So, and I just don't know the exact numbers, but just for this group to be aware, there's nothing new that's going to be shared at tomorrow meetings, except probably just clarification around the new guidance that we've offered, the updated dashboard so people can see the new cases with the that will be updated. And I don't think nothing else, Mary Jane, right?
No, I don't think so. We're continuing to update though the information as schools submit their data about their staff vaccination rates. So that's one thing that's going to be continued to be updated. And then we can anticipate future that we'll be seeing data related to the Binax tests, how many tests were given and how many positives were there. One of the positive things about the data we're collecting is that when you fill out the form related to utilization of a Binax test, you are also identifying what symptoms were there. So we'll be able to triangulate the symptom that was identified to a positive or negative. So down the road, we will have some additional data there too. So we're going to continue to collect this data and provide good information. Lisa, congratulations on presenting to the statewide group. I mean, no, seriously, this data is very, the reason, one of the many reasons that we find ourselves where we are in the county is the fact that we've had some data to rely on that is specific to Marin, and some research that you have been involved in specific to Marin. So not just relying on other places, but also, you know, what we can see here. So I think you should be very proud. And the fact that we have a statewide pilot for Binex, we're the only ones that are involved in the pilot. And our hope is by November, everybody, every staff, every student, including every school, has the supply they need so that we have information within 15 minutes instead of within 48 to 72 hours, which we know has not provided us the best level of information. So you should be proud, Lisa. We're very proud.
Well, I'm thankful for all of you. This has been a true team effort. And again, it's for the labor leaders and staff. I appreciate your volunteerism and how much time you spend to keep your members informed and engaged. It's not easy, and I really appreciate this and your time. And I again, Morgan can tell you, sometimes I'm late in responding, but I really do strive. It's my personal goal to respond to every email and inquiry I get. And sometimes I'm delayed only because I'm trying to be thoughtful in my response. And I think that's part of the accountability that we hold. Besides being transparent, we want to be accountable and having responses, even though sometimes I write to people, you know, I understand you disagree with me, and that's you're right, but we try to hold ourselves accountable and try and share the references and the information that we're receiving that's driving some of our recommendations or decisions. So please don't ever hesitate to email me directly. And again, it's my goal every day is to clear out my inbox. Some days I'm better than others.
Lisa, be careful. We have 6,858 school employees.
I'm talking to the leaders that volunteer their time.
I know, I understand.
Don't worry, I think 200,000 people have my email sometimes.
Like, I'm sure they do. Okay, everybody, oh my gosh, you got 5 minutes, extra minutes. What are you gonna do with that? Okay, bye.
Do some sit-ups.
Sit-ups, oh, no kidding. Okay, bye, everybody.
Bye.